Welcome everyone to the CEIH Improvement and Innovation Showcase. Today's showcase is the first of Series 11. We're really excited. Today's topic is, or the session topic is around strengthening healthcare workforce wellbeing in South Australia. It's certainly a topic dear to our heart. Before I move on, I'd really like to acknowledge that this land we meet on today is the traditional lands of the Kaurna people and that we respect their spiritual relationship with country. We also acknowledge that the Kaurna people are the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Kaurna people today. I also acknowledge any other lands that people might be joining from today. So my name's Nadia Masterson. I'm the Director of the Partnerships Program here in the Commission on Excellence and Innovation in Health. For those of you unfamiliar with what we affectionately call CEIH, we are the lead agency for innovation in healthcare in South Australia, and we focus on bringing consumers, clinicians and others together to collaborate to turn ideas into better healthcare. So our vision simply, and it's a large vision, is together, let's create better healthcare for South Australians. To do this, we need to support our sector to come together to imagine new ideas for better healthcare. And we acknowledge that better isn't always perfect, but that we make a commitment to measuring it and being able to see that change. So what if the big idea was connecting all those small ideas? This is the essence of why we host the Innovation and Improvement Showcases here. It's about helping to connect us across South Australia and about sharing those improvements and innovations, and sometimes both. So the Improvement and Innovation Showcase is on Thursdays at 1 o'clock. So when we've got a session running or a series running, it runs at 11 o'clock every day, every week, and online whenever. So they're recorded and soon put onto our website. It is about bringing those healthcare teams together and providing a safe space where we can explore what others have learned. We really aim to keep it simple, to share work that's happening across the sector at any stage or level of success, instead of just waiting until work's complete and ready to be published. So we focus on work across South Australia, and every now and then we like to showcase something outside our state to ignite ideas and thinking. So just keep in mind, if you've got a story to tell or share, or if you've succeeded in solving a problem or learnt something while trying, please let us know if you've got a theme or a topic you'd like to explore. So as I mentioned, we're really excited that this series is about strengthening healthcare workplace wellbeing in South Australia. We've got 6 fabulous presentations across the series. I'm really looking forward to all of them. And there's still time to register if you haven't registered for some of our later sessions. So today I'm excited to present Katie Billing, who's the Executive Director of Consumer and Clinical Partnerships in CEIH, and Isla Woidt, who is the Manager of Workforce Wellbeing in CEIH in the Partnerships team. So I'm going to hand over to Isla and stop sharing. And Katie.
Thank you so much, Nadia, and thank you all for joining us today, either in real time or for viewing the video retrospectively. It's a great privilege to kick off this showcase around strengthening workplace wellbeing for this series of the Improvement and Innovation Showcase. And I must say, this is the first time that a CEIH presentation has been a presentation in our showcase, but we did feel that it was important to share with you all the work that we've been doing in this space, and really pleased to see, Nadia, the slide that talks to the rest of the presentations that are coming up over the next few weeks. Really excited to join those and learn from others. So Isla and I are going to talk a little bit today about the CEIH and the work that we've been doing to create excellence in workplace wellbeing. And what we've decided to talk about a little bit today is what does this really look like? Before I kick off, I would really like to start with what is our why? And really to talk about, so if you're Nadia's just talked about how the CEIH is the Commission on Excellence in Innovation in Health and the lead agency for innovation. So why workforce wellbeing? At CEIH, we worked out pretty early on that in order for our health system to be able to provide world-class, high-quality patient care and strive for innovation and excellence, people need to have the necessary bandwidth to do things and to innovate and to change. And we talk about this a little bit in terms of, having a sponge, if you like. If you've got a sponge that's completely wrung out, actually, you don't have any capacity in there to do anything else. And so how do you fill up the cups? How do you actually move people to a place where the workplace wellbeing is looked after, and where the culture means that we can actually affect patient care in a positive way? And we're sharing here on the screen the quadruple aim of health, which for some of you will be something you're familiar with, certainly recognising that, yes, we need to work to improve the health of populations, reduce the cost of healthcare, improve patient experiences and outcomes, but also to improve the wellbeing of the caregiving team. For the CEIH to do our work, we need to have our partners who deliver healthcare in a position where they can do that. And so we recognise that it is circular. Certainly improving and innovating does improve people's experience of work. It does improve outcomes, and it does deliver better for patients and for our community. And so actually there is an opportunity for us to look at innovation in workplace wellbeing culture. And so that's what we're here to talk a little bit about today. We were established in 2019 into 2020, and right from the very beginning, we were looking at creating those better outcomes and experiences for everyone, and that certainly was in our initial strategic plan, was to say, we need better experiences and outcomes for consumers, but actually we just want better outcomes and experiences for everyone in the system. In 2020, 2021, we started by doing some things around the pandemic kindness movement. So this was a part of COVID in response to supporting our workforce for COVID, and this is a national initiative that CEIH was a partner in, and also locally holding a compassion collaborative through Mary Frere's work at the Freer Thinking organisation. And that was really fantastic, and a great opportunity for us to sort of provide some support. Early in 2022, we had the right alignment of leadership, but also, I guess, a position where we had reached the point where we knew to achieve what we needed to achieve in terms of innovation and improvement, we needed to do something ourselves to support the system. And so we kicked off by some dedicated resource and some commitment by our action. And that was really, in the first instance, to start by a review of literature, to look at the evidence and to define the problem, and really use evidence to drive what a desired future state might look like. We followed on from there by doing some broader consultation, and we certainly we knew that we needed to, I guess, define the current state in South Australia. But remembering mid-2022, people working in the health sector were pretty busy, and certainly caught up with COVID still. And so we knew that we needed to do that with existing data and with existing information that we had. So we worked through unpacking the enablers and the barriers for evidence-based solutions, and we did that through quite a lot of consultation across the state with senior leaders. At the end of last year, we were able to develop a strategic approach and take that through into a publication and work towards very early this year publication of a discussion paper and an organisational guide. And then at the beginning of this year, we started off the year with an opportunity to work with leadership, senior leadership, specifically for SA Health, around the development of the Advancing Healthcare Workforce Wellbeing plan. And this is a plan for collaborative action across the state. And we're going to talk more about these things throughout the presentation today. So our aim, I guess, in terms of what we were trying to achieve was really about wanting to make sure we were driving everything with evidence. And at the CEIH, everything we do, we aim to be evidence-based. And so we, with that evidence, we're driving towards how we could use evidence perhaps that's come from other organisations, come from other industries, and apply it in the context of SA Health. I'm going to hand over to Isla now, who's going to walk us through that evidence for a little while. Isla.
Thanks, Katie. So yeah, as Katie said, it's really important that in order to create excellence, we must first define it. So for CEIH, it's been really important to have a robust and evidence-based approach to our work. So what we did was draw on global workplace wellbeing evidence, not just in the healthcare setting, so there's a lot in the healthcare setting, but more broadly, as there's so much research and evidence that we can draw from. So in particular, we built on some of the best practice frameworks being promoted by the Collaborative Partnership for Workplace Health and Wellbeing in South Australia, and applied it specifically to our healthcare context. And it's really exciting that we'll be able to hear a bit more about that work later on in the showcase series. So what is the contemporary view of workplace wellbeing? Traditionally, workplace wellbeing, I guess, had more of a health promotion focus. So really focusing on creating health promoting workplace environments and programs to support healthy lifestyle behaviours of workers and individuals. And then there was WHS on the side that obviously has always had a focus on mitigation of risk and the prevention of injury. But what's really become clear over the last decade or so is that we're going to get the best, not only organisational outcomes, but obviously individual health and safety outcomes by having the intersect between the two approaches. So one framework that particularly supports this is what you can see on the screen here, is what's known as the total worker health model. And that's really emerged from the US, and there's a lot of evidence to support that around the intersect of protection and promotion. And then building on from this is the concept of an integrated approach to total worker health. And basically what that refers to is the shared responsibility of the importance of workforce wellbeing and worker wellbeing across the disciplines of work health and safety, so WHS, health promotion, and human resources and organisational development. So best practice tells us that the most impact, again at that organisational and individual level, is where the efforts stretch across all of those key disciplines and are embedded into, the systems, practices, processes of those. But through our work, what's become really obvious and evidence, well, there seemed to be a bit of a missing player in the room. What these kind of best practice models didn't really pull out, and what was unique to healthcare, was the importance of quality and safety and continuous improvement and clinical governance teams. Because obviously there's a really key synergies between what we know that worker safety and wellbeing is directly linked to patient safety and quality healthcare outcomes, like Katie presented before. So we added them to the top of the triangle because we thought that was really, really important in the healthcare setting. And then when we talk about what actually creates a healthy workplace culture, what evidence-based models, like the one you see on the right here, confirm to us that healthy workplaces are not just those that offer individual programs around behaviour change, which is what we have traditionally seen. Healthy workplaces are those that put equal focus on creating working conditions, physical work environments, systems, processes and cultures that prioritise the protection and promotion of health and wellbeing. And that's what you can see in the 3 points of the triangle in the blue. And this stems back to the Healthy Workplaces model that came out from the World Health Organization that has been around for some time. So really, we'd only be applying band-aids if we keep focusing on interventions that focus on individual behaviour change instead of the organisational factors and policy and community contexts and systems that surround it. So recognising the complexity of our healthcare sector that I'm sure we're all aware of, and also that what evidence tells us influences work and workplace wellbeing, CEIH was really important for us to take a systems approach to this work. So noting that for change to occur, action needs to happen across all levels of the system. And so with all key determinants of health, we all have a role to play within our sphere of control. So we found it really important to give visibility, to really understand and give visibility to what it actually is and what the role is in all those levels of the system, right from workers, managers, teams, executives, organisations, and then obviously looking at it from a sector and system point of view. I mean, you can imagine if we harness all that collective action, what impact really we can have. So if I take us back to around May last year, like Katie said, we by that stage, we had a really good understanding of what global best practice and evidence was telling us, what excellence looked like, and what the lead indicators were across all levels of the system. But we really needed to unpack then what was actually happening in South Australia. So what's the current state of play across all those levels? So we embarked on a process to build on current sources of data. So there was already a lot of data and literature out there, but interviewed about 50 leaders across the sector and key stakeholders to validate what we'd read and heard and add to that. We primarily focused on the acute public sector, health sector at that stage for the first phase, as well as engaging public health networks, Aboriginal Health Council, Commissioner of Public Sector Employment and other such stakeholders. And what we really wanted to understand also was what are some of the main barriers and enablers for implementing evidence-based solutions. So if we knew what excellence looks like, what's stopping us from getting there? I won't go into a huge amount of detail today because obviously there's a lot there, but we have actually published this in a separate report that is available on our website, and I think the team might put a link to that in the chat. But what I want to pull out was some key themes across what we heard. What was interesting that what emerged across both the system and sector level and organisational level were very similar themes. And what we heard was that there seemed to be limited leadership and governance structures, and I guess a collaborative action. There was limited collaborative action happening both at the sector and organisational level. And what we know is this is really important for establishing commitment, coordination, and also accountability metrics. So there's certainly an opportunity there. We heard that there was inadequate capacity and resourcing across all levels. So there was no dedicated wellbeing roles in place in many organisations and certainly at the sector level, and no time for managers to dedicate to supporting the wellbeing of their team. And when there was programs and initiatives in place, staff unfortunately just didn't even have the time to engage. So there was, a lot of conversations about how can we not only increase, but actually mobilise the capacity that already exists within the system to be working towards a common goal. There was certainly an expressed need for capability building to be able to really effectively identify, understand and address the root causes of suboptimal workforce wellbeing. We heard a lot about, I know my organisation, my team, my people are struggling, I just don't know what to do about it. So there's certainly, again, an opportunity there. Wellbeing measurement and metrics came up quite a lot in our conversations. And what we found was there was limited consistent metrics, again, at the sector level and then also at an organisational level. So there were certainly pockets of it, but certainly nothing consistent. And the ones that did have data in place were struggling to put that into meaningful reporting mechanisms to aid accountability and to guide action. And then finally, and certainly not least, it was clear that there were some really big work design factors that were having a huge impact on worker burnout and stress. Some of those were around rostering practices, staff shortages, behaviours in the workplace, incivility, fatigue management practices, and the increasing administrative burden that healthcare workers have in place. So I guess in summary, what we found that there was clearly a disconnect between what's considered excellence when we talk about a healthy and thriving workplace and what that actually looks like in practice in a healthcare setting versus what we're seeing currently, what we were seeing 12 months ago at the current state in South Australia. And it really, I guess, begged the question of how can we shift the dial on what is clearly a very complex and multifaceted issue, and also where do we start? So I'm going to hand back over to you, Katie, to talk through that a bit more.
Thanks, Isla. That's a fantastic overview from an evidence and findings point of view from the work that we did to contextualise that to South Australia. So thank you for sharing that. So where to from there for us with that in mind? The CEIH, I guess, again, was recognising that there was a need, and our aim ultimately was determined to be creating a culture of excellence that protects and promotes healthcare worker wellbeing. We're doing this in a context that we know many of you who have joined us today are living and breathing every day, a time where people are looking for answers and are looking for something really tangible to grab hold of, and that's been really critical to the work that we've done. The CEIH's priority areas for system level change have come, not surprisingly, they'll probably look a little bit familiar because they're really closely aligned to the themes that Isla has just talked through. Our priority level areas for system level change are establishing and strengthening leadership and governance structures, mobilising capacity, and building wellbeing capability across all levels. And I think it's really important to point out at this point that building capability across all levels is quite nuanced. It's recognising that wellbeing capability is both something that can be built across all levels as a core competency, and recognising the different skills and knowledge that can be at all levels, but also recognising that having it as a strategic priority through the leadership governance structures means that we recognise where specialist skills are required, and certainly working across the system and working through our work to try and understand the right balance of expertise in wellbeing and general capability in building wellbeing across teams across the sector. Isla talked about actionable data insights, being able to measure what matters, and this is really important to us, making sure that we're in a position where we know that when you want something to change, you have to measure it. And certainly the CEIH's work around patient-reported measures is another example where we've said actually if patient-reported outcomes and experiences matter, then we need to measure them. Actually being able to have actionable data insights around workforce wellbeing is a key priority. Collaborating also to tackle systemic issues and enable good work design. This, in translation, is about how do you make people's jobs great? How do you make people's work that they come to do for work every day engaging, meaningful, and really something that their work and in their workplace every day. So far, we've completed a few things, and Isla referred to the documentation that we've published. So I think the team have already shared in the chat the publications on strengthening health workforce wellbeing in South Australia, and that's a discussion paper. There's a picture on the slide there, and also the guide. So this is really the work that the team at the CEIH have done a fantastic job, in my opinion, of translating how you might do this, how you might take the steps to move in the right direction. We've also produced a measuring workplace wellbeing fact sheet, which has been shared in the chat now as well, and that is also a really great guide to understanding not just how you might introduce new measures, but actually what have you already got, what is already in front of you in terms of understanding workplace wellbeing. Really importantly, a key outcome for us has been establishing a leadership and governance forum for SA Health and in support of SA Health. And so we've been really pleased with the engagement from a senior executive CEO level across SA Health with the establishment of a subcommittee of the Chief Executives Council, where we have a focus on sector level leadership of health workforce wellbeing. Through that subcommittee and working with that subcommittee, we facilitated the development of the Advancing Healthcare Workforce Wellbeing Plan for the system, and that's a collaborative action plan for SA Health. And we've also been, as one of the actions out of that, of looking at leadership capability, we have been, have led and will continue to lead some sessions around psychological safety responsibilities. We're also working with SA Health towards embedding some wellbeing metrics, including some KPIs, which is really exciting, and some more meaningful reporting. So from here, I guess we really thought about, if this is our work, then how do we work together as a sector? What's the call to action for us to collaborate across the sector? And I guess the opportunities that we'd like to identify today are the opportunities to provide coordinated and effective sector leadership, to increase capacity and dedicated resourcing to drive action, providing capability building opportunities, and this showcase forms one of those, to guide evidence-based action. And the evidence base is really critical to us to address those work-related factors in influencing worker wellbeing. We're also suggesting that we work towards establishing consistent metrics and routine measurement of workforce wellbeing, and also empowering the workforce to co-design strategies that address systemic factors impacting their wellbeing. And certainly one of the areas that one of the teams that we've been talking to and working with has been the team from Centre of Transformative Work Design. I think I've got that right, CTWD at Curtin University, and they use the acronym which I love now, which is a SMART. How do we create smart work design, which is about stimulating mastery, agency, relationable, tolerable work. If you haven't looked it up, it's worth looking up once you've read our papers. But certainly really fantastic work around how you can actually design work and redesign people's jobs. So we're really excited about that element of creating the workforce wellbeing culture. So just in closing, I guess, an encouragement from what we've seen. Certainly there's some pockets of excellence across the sector in South Australia, and I'm sure nationally. There's some pockets of excellence, and certainly there is many people who are starting to recognise that it is about recognising the environment that people are coming to work in every day, and recognising that actually if we are going to be able to continue to deliver excellent services in South Australia and in Australia, but also if we're going to be able to meet the demand, if we're going to be able to deliver on effectiveness and efficiency in terms of healthcare experiences and outcomes for consumers, we need to get it right for our health workforce. And it seems like it's a mountain ahead of you when you put it like that. Our encouragement and our suggestion is that we need to think big, but actually you can start small. And certainly happy to chat more through question time for those that are joining us live. But the encouragement is if nothing else, then start to ask, what is it that drives you crazy every day? What is it that we can address? What is it that you can see that would give you the opportunity to, for your teams, that you would give you the opportunity to work in an environment where coming to work is something that that helps you to thrive, and that's really the environment that we're keen to see develop. We talk a lot about pebbles in the shoe, and if you aren't already familiar with that analogy, it's a really useful one that we find. And I'll just close out in saying, recognising that it's not the mountain ahead that wears you out, it's the pebble in your shoe. And certainly this is the experience that we hear from people who deliver health care services across the sector, whether that be clinicians or administrative and support staff across our sector, who have really just given their all over the last 3 years above and beyond what they always do. So really grateful once again to those of you who do that work, who have joined the call today, and for the leaders who are joining us today who would like to come on board and work with us. We're really keen to hear from you and work alongside of you. I think that's probably us, Nadia. I might hand back to you, and very happy to take any questions from the floor.
Wonderful. Thank you so much, Katie and Isla, for that first presentation around strengthening and building workforce wellbeing in the SA health sector. That concludes the formal part of today's presentations.